Assalamu alaikum warahmatullahi wabarakatuh. Good morning. My name is Dr. Abdur-rahman, and I'm here once again with a new episode to give you some basic facts. To be honest with you, when I started this video, there was no plan. I wasn't planning to do anything. In fact, I was just testing this mic. But because of us, we tend to procrastinate, I just said, okay, I'm going to open this video and I'm going to say whatever I want to say, and I'm definitely going to post it. So, the first thing that would come to mind now to advise you with is regards let me just say hypertension. You see, there are two types of hypertension, and a lot of people mix this up. There is primary hypertension and then there is secondary hypertension. I'll start with secondary hypertension. For secondary hypertension, it is caused by a particular underlying disease and underlying pathology. Get? So that means it's secondary to something, which means once that disease is taken care of, it goes, your blood pressure goes back to normal. The other one is primary hypertension. For primary hypertension, the actual cause is not known. However, it has been postulated that either due to age, for those above 40, being a black man, some other genetic factors that can contribute to you developing it, especially family history of hypertension. So that's the primary hypertension. You understand? Some people, they have secondary hypertension, and then this, if it's not really taken care of, then it persists. And after some time, if it's identified and taken care of, you see, they notice that their BP comes back to normal, and then they stop taking antihypertensives. But for those with primary hypertension, especially the elderly, you have to be on your antihypertensives. You understand? There are various types of antihypertensives that are effective. So you discuss with your doctor, they place on an antihypertensive that you have to actually take for life, because for now, there is no designated or permanent cure scientifically for primary hypertension. So you have to stick with your medication and take it judiciously. Because if you don't, what could happen? You understand? It's far more deadly than whatever you think. The taking the drugs daily will cause. And for most people, they feel like I can't be on drugs daily. I can't be taking medication daily. Well, you need to understand that you eat daily. You take waters. You drink water daily because your body needs it. If you find yourself in this situation, you need to actually be very vigilant with your medication and take it. You're supposed to take it. Because the fact that the blood goes to all the parts of the body, it means particularly any of the system can be affected. From your brain, can get stroke, can get a very severe pounding headache, can affect your eyes, you can go blind, honestly. Can affect your chest, can affect your heart, can affect your abdomen, your liver, your kidneys, just name it. So the safer option is for you to take your medication, especially if you have primary hypertension. Secondary hypertension, usually this primary hypertension is common in the elderly, all above for 40 years and above. But for secondary hypertension, usually common in the young people. You understand? For younger people, they tend to have secondary hypertension more. And so any young person with hypertension, the person needs to do a thorough investigation. Go for renal artery scan, go for luminal scan, go for kidney function test, check your lipids, you understand? Do a chest X-ray, there are basic investigations due to some certain causes that makes the young come up with hypertension. So if you are somebody if you are young and you're hypertensive, don't say over my dead body. Try to see a doctor or a specialist or a cardiologist so that they send you for some certain investigations that commonly cause this as secondary hypertension in the young. So with this, I hope I've given some benefit to those watching, and watch out for more of these.